Good afternoon. Good afternoon, everyone. This is Dr. Velma Scantlebury, and I am here live with Dialysis Patient Citizens Educational Program, and this is our last program for 2025. Could you believe that? The year is about to end, so I am excited to be here, and again, I hope this reaches some people. I know it's getting into the holiday season, and I'm trying to, create a little bit of holiday cheer by having these poinsettias here, making it look like it's Christmas time, and really trying to get into the spirit. So again, I see there's someone out in here. Just say hello. I'm Dr. Velma Scantlebury, and this is Dialysis Patient Citizens Educational Program. We are here with Ask the Doctor, and this is a live program. It's Wednesday afternoon, December 17th, and we're closing out the year. So thank you, Nancy, for coming on. I know this is a time of year that we value. Most of us who like to get together, whether it's the holiday season, whether it's Hanukkah, whether it's just getting together with friends and family. So it's oftentimes away from the work schedule. We get a few days off, and some people take vacation time, so that is always an opportunity to do some fun things, and a chance to really connect with friends and family, especially family. I think of this time of year as really about getting together with family. We know the spirit of Christmas and the spirit of giving, and just being grateful for the things that we have been given, and the opportunities that we have to help others, and the opportunity that we have to serve others. And I always say that, being here on earth is really a job of service, and how can we give it, what's our purpose, and how can we live out that purpose in serving. And it's for me, it's about really trying to figure out where can I fit in and what can I do to help others. And I know for many people it's also a time of sadness, in terms of the holidays can get us down. The holidays, if you are by yourself, or you may have had loss of family, of friends. I know many. I was on a call today, and this pastor said he has 7 close friends that were buried in the last 10 days. And that can often be really a sad moment, and acknowledging that, well, we all will someday go on, and so we want to be able to figure out how can we make the best of what we have, and how can we really be positive in our outlook. So if you are on dialysis, you may be thinking, well, can I get on the transplant list? If you're not on dialysis and you're in that stage 4 to 5, you may also get on a transplant list. If it has not been discussed with you, you want to make sure that you bring it up to your doctor, because as long as your eGFR is 20% or less, you can be listed for time. You may not be ready to get transplanted. You may not even be ready to start dialysis, but all you need is that eGFR 20% or less. And even though you're functioning, you can be referred to the transplant center. And there's some people who are actually referred before, while they're 22, 23, and they get to start the process knowing that these are things that's coming down the line. So yes, you don't have to be on dialysis. You can ask your doctor for a referral to the transplant center. And in most states, you can often refer yourself to get transplanted or to get on the list and get started in the process. It will take a little while to verify your insurance. For some patients, if you're not on dialysis and you don't qualify for Medicare based on your disability or based on disability, then you may not be able to get on the list without Medicare. So if you're on Medicaid, in many states does not cover transplant, unfortunately, and you will then have to wait until you are qualified for Medicare, either by a disability or by starting dialysis. So those two things are important to understand, that it's the Medicare that will cover your workup for transplant based on the disability of end-stage kidney disease. So once you get that label of end-stage kidney disease, if you're over 65 or have a disability and already qualify for Medicare based on that, then you can be listed for a transplant because you already have Medicare. So that's important. Send a text or make some phone call, who's having a tough time. That is true. We're talking about, the holidays and how oftentimes that we can feel, it can cause us to feel down. One of the things is that we get into comparison, and that's the downside of social media. We begin to see all these wonderful things on social media and begin to think, why don't I have that? So stop comparing yourself. Shut down social media if it's really getting you down, and focus on what you can do, your expectation. How can you reach out to someone, as Nancy said, send a text, and lower your expectations when you're going out to gather with others. Maybe just one thing you expect from that. Maybe I'm gonna meet my cousin from Baltimore, and I'm just going to find out how her trip is, and that's my one expectation. My one expectation is to meet the neighbor's 2 grandkids or whatever it may be. And so you want to be able to do that and not have a whole list of expectations that will cause you to be disappointed. Yolanda says, welcome to all who have joined this Facebook Live with dialysis patients. We're happy you're here. Thank you so much for all of you who are joining. And it's important for you to understand that it's okay to be sad at some times, but it doesn't mean that you're down, because you may get upset sometimes in traffic. It is terrible, but it doesn't mean that you're sad. And so you want to make sure that you combat the loneliness of the holidays. Send, like you said, pick up the phone, talk to someone, send a text. Even oftentimes you don't want to speak to someone, you can really communicate through text and just said, hello, how are you doing? Just being able to be conscious of other people and how they're feeling as well. Maybe what you sent will give them a little bit of hope and understanding that, okay, this person hasn't forgotten me. And, as we come into the holidays, as we did with Thanksgiving, be careful with your fluid intake. Nancy says, monitor that fluid and make sure that as the table is filled with all these kinds of different foods, that you're not going to drive your potassium out of whack, or you're not going to increase so much of your fluid intake that you jeopardize your dialysis, especially if you have an early dialysis. If we know the holiday is Thursday. If you're, many people will get dialyzed on Friday, so that it may not be necessarily a problem, but you also don't want to gain so much fluid that you put yourself at jeopardy. It's one day to connect if you're able to connect, but just remember that you have a whole lot more days coming down the line that you don't necessarily want to jeopardize your heart, because remember, increasing fluids means more work for your heart if you're unable to urinate and get some of that fluid out. So that is something to remember. Potassium is, as you increase your potassium in many of the foods, whether it's those with macaroni and cheese, you want to limit that. Whether it's the mashed potatoes, those kind of things can absolutely push your potassium up and can cause dysrhythmia with your heart when it gets to be too high, especially if you're not, I hope you're not planning on skipping any dialysis treatments. But remember, if you're not dialyzing that Saturday, Sunday, if you dialyze in the Saturday, and you were dialyzed on Thursday, Friday, Saturday, you want to make sure that you're not driving that potassium through the roof so that you end up with heart problems. And also, as you know, you think about where are you on the dialysis? Are you at the point where have you been referred for transplant? Do you think you should be referred for transplant? If you have not been referred to transplant, why not? In terms of talk to your doctor, what can I do to optimize my position to get on that transplant list? And if you've been waiting a while, then the other option is, okay, if I'm one of those common blood types, O or A, have I thought about a living donor in any way possible? Are they friends? Are they family? Remember, you don't have to be related. You don't even have to be the same blood type. You just have to be compatible. And that is even in terms of spouses. Oftentimes, they're not the same blood type. They have nothing in common. But what happens is that they don't share any antibodies against each other. So as long as if you're blood type O, then you have to receive from an O. If you're blood type A, you can receive from a O or A. So that compatibility is necessary. But in terms of having the same genes, it will be markers, genetic markers that we match when you're on the list. Many people who get transplanted get based on blood type and may not actually share anything in common. It's just that they're still compatible from that standpoint. So you want to know what's holding you up from getting listed. Is it that you still have to have your dental clearance? Are you still pending your heart clearance? Are you still pending having a procedure done, like a colonoscopy? So have a list of the things that you want to eliminate so that you can begin to be actively transplanted, be actively listed, knowing that for many people, because you're still on dialysis, there's usually not a lot of incentive to get you on the list because your time will still be the same starting from the time you started dialysis. Whether you go on now or whether you go on 6 months from now, you will still be gaining that time from the time you started dialysis. In the past, when it was that you gained time from the time you were listed, it was important, but now it's not, as long as you have that time from starting dialysis. If you're not on dialysis, that's when it matters to go ahead and get, even if it's inactively listed, because then the clock starts ticking because you're not on dialysis. Should renal patients get genetic testing? Depends on what kind of genetic abnormality you're looking for. If you're talking about when it comes to kidney disease, or you're talking about when it comes to cancer screening, the things that in terms of looking at whether you have a family history of prostate and breast cancer, then that's something you talk to your oncology or your geneticist, or even your breast surgeon about, in terms of looking at if there's a high incidence of breast cancer in your family and your risk of developing that, if you have siblings, first degree, mother. Those are things that worth discussion about, especially if you know there's a link to breast cancer and prostate cancer in the men from that standpoint. If you're talking about genetic testing in terms of APOL testing for hypertension, the issue is probably not, it's not worth it for renal patients. You're already on dialysis. It may be worth it if you feel that your family has a strong history of high blood pressure leading to kidney disease. Those who do not have kidney disease may be worth testing to see if they have that APOL gene, if there's a way to predict and be monitored closely to prevent the development of kidney disease from hypertension based on that genetic connection from that standpoint. So I hope that answers your question. Marcine said, I just can't seem to lower my creatinine. Why? Generally depends on if you're on hemodialysis or peritoneal dialysis, generally, as the membranes can get thicker in your abdomen of peritoneal dialysis, oftentimes it can be more difficult over time to clear creatinine. Oftentimes they may have to change the bath to see and make it more concentrated, see if they can pull more out from PD. And hemo, generally, for most people on a regular hemo, it's really there to keep you out of trouble, but for most patients, it's not designed to bring you much lower, depending on what's your size and your creatinine. It depends on your bath and how, whether you're doing 3.5 hours or 4 hours, as most patients sometimes want to cut the time short. That may lead you open to not getting your creatinine down all the way. That's why for some patients, it's the home dialysis or the more slower nocturnal dialysis can work better because there's longer time to allow the exudates to get out of your system. So we often find that when patients get hospitalized for a procedure or for anything that keeps them in the hospital for a few days and they need to be dialyzed while they're in-house, the dialysis is different and they get a much better fall in the creatinine while they're in the hospital. So it can often be the baths and the combination of what you're hooked up to. So that's a discussion you can have with your healthcare provider. I struggle with blood pressure. I was diagnosed at 18 with hypertension. We're now trying to struggle to see the right medications to stabilize my blood pressure. And again, depending on what workup you have, if it's been diagnosed that early, did they look to see whether you had renal artery stenosis? Did they look to see whether this was etiology in your adrenals, in increase in renin production? There's a whole workup that oftentimes you want to see if there's a source of something in your body. It could be contributing to that blood pressure being that high at such an early age in terms of abnormal secretion. And oftentimes from that standpoint, it will require multiple medications to control your blood pressure. But again, make sure that you've gone through the workup to look to see if there's any underlying anatomical causes for that high blood pressure, as well as looking at hormone secretion to see if there's anything there. I hope that helps. Marcine is a kidney transplant recipient. Let me see. I can't see. Okay, Marcine, I can't seem to lower my creatinine. Again, that depends on the donor kidney. The state of the donor kidney, how far out you are from transplant. Early on, it may take a longer time depending. And sorry about that connection. And that means that somewhere along the line, either the insults that were suffered, that the donor suffered, pressure might have been low, urine output might have been decreased, and the injury in the donor could often cause your creatinine not to get any lower. It depends on if you're at 2 months, 6 months, or a year. So that baseline can be, and oftentimes this is when we would biopsy the kidney to see whether there's underlying scarring in the kidney based on the age of the donor. Oftentimes it's not often predictable, but after the kidney is in and we can't figure out why it's lower, cannot go lower, we biopsy. Is it rejection? That's oftentimes why we will do a biopsy, or we will look at the percentage of donor cells being secreted in your blood. Is a test for that to see whether you have developed antibodies against that kidney. There's a few reasons in terms of why isn't that creatinine any better. And then once we eliminate any possible treatment, then the goal is to make sure that there's adequate blood flow to the kidney, all the different things, whether it's anatomical or not, or whether it's medications or whether it's rejection. Those are the formula we go through, checking your virus infections, the BK virus, CMV, things that would cause inflammation in the kidney, even for some people, even possibilities of recurrent disease. whether it's protein in your urine, things that can cause the creatinine to remain elevated. So there's a battery of like an algorithm that we go through to make sure that we're not missing anything. So thank you for that question. Thank you who was representing Wisconsin. For all of you that are here, thank you all for being here. Yolanda, again, also to you. And if some of you are here for the first time, I certainly thank you for showing up and hope that you will continue to join us. The goal is to be able to ask your questions. This is a psychologically safe room here on the internet, but the goal is to be able to answer them as best as I can. If I don't have those answers, I will get back to you with that particular answer, hopefully on social media as the questions are posted there after this goes on to Facebook. So I hope you can see me. It looks like I have a slow connection, even though it's saying I'm good. But thank you, Christopher, for joining us. Again, I'm Dr. Velma Scantlebury, medical consultant here at Dialysis Patient Assistance Educational Center. I'm a retired transplant surgeon, seeing transplant patients still, as well as medical patients on their path to wellness, whether it's due with hypertension, diabetes, chronic kidney disease, just really educating folks in terms of learning about their processes, what they need to do to improve their health. Remember, as we said, we go into the holiday season, just remember to protect your heart. Your heart, that's the engine that's going. And without a good heart, everything you do, you want to be able, is this going to impact my heart? Whether it's your food, you want to keep your cholesterol down because that's going to impact your heart. If you're diabetic, you want to keep your blood sugar down because that's going to impact your heart. Your fluid gains, you want to make sure you're conscious of that because that's going to impact your heart. So those are all important things to remember. Remember, holidays are one day, but you still have many more days if God permitting or whoever you serve permits, that you want to be able to see in the future, if that is your destiny. So I thank you all for being here. We have a few more minutes. If there's any questions, let me know. If not, we can we can all, put in the chat as we come to the end of this year. We should have a sense of gratitude for one or two things. Post what you're grateful for, because it certainly is, we've had our downs and we've had our ups. It's been rough for many people, but it's also, we're still alive. Our heart's still working and we're still here. We're not 6 feet under. And so with that is always a gratitude to be able to know that there's help coming. I can help someone. I know that being here hopefully is of a help to you. And I am grateful for the knowledge and capability that I have to share with others, and to, if I can move one person to do better, then I know that I have accomplished something. So tell us about the effects of stress on patients on end-stage renal disease. Stress affects everything. It's not just end-stage renal disease. Stress causes our flight emotion. It revs up our cortisone. It causes us to be anxious. And so just imagine if you were constantly in a revved up mode, and what that would do to your system if you drove constantly with your feet in the brake and the gas at the same time. So it would eventually wear your car down. So it's important to realize that we have to remember to de-stress. At the end of the day, the one thing we say is get a good night's sleep. If you can, find something to distract your mind, figure out what it is for you to do to be in that zone where you're not constantly thinking about the next thing. And whether it's listening to music, whether it's dancing, whether it's classical music, whether it's just some kind of mindfulness, because our minds are constantly going. Even as women, and men sometimes, we have so much in our mind that we have planning to do constantly. And that can be overwhelming, the expectation that you have to do A, B, C, D. And so where is your mindfulness in terms of when can you just back off? When can you empty your brain? I've been told this once, that before you go to bed, we're always thinking about all the things that we have to do. Oh, even when we're in bed sleeping, we're thinking, oh, I have to remember to wake up and do A, B, C. Oh, I have to do this in the morning. Get a little notebook, put by your bed. And so my advice to you is to learn how to brain dump. Dump all those things in your mind in your little book or piece of paper. Get them out your mind before you go to bed. And you do that brain dump, then you may be able to sleep a little better. So my advice is to figure out how you can be joyful even in a time of stress. Learn how to eliminate those things from your head. So dump those things out your brain. Try not to multitask too much. I switched to trying to record the things I need to do on my cell phone, but pen and paper works better if I can actually see it, as opposed to try to figure out where I put it on my phone. And having that representation of, these are the 4 things I'm going to do today, so that you minimize your list and you do small things, only microdose. Don't macrodose yourself with a lot of things to do. Today, I'm going to focus on 2 things. And so that should be your goal, so that you're not overstressing. I like to read, so I listen to books on tape, and I also like to listen to podcasts. So those are relaxing things for me to do, and I go to church. Those are often times where I know during that period of time I am disconnecting. And so for you, find ways to disconnect. And for everybody, whether you're on end-stage renal disease or not, you have to figure out, how can I disconnect from this world? Turn the TV off. Don't listen to the news, which can be very upsetting. Stay away from social media for X number of hours during the day. You're going to go look or just eliminate it for a few days over the holidays. There's nothing there that you're going to miss out. It'll still be there when you come back. So that's my advice because social media can be very stressful. It puts us in this mode of, how come I'm not like this? Stop the comparison and let's enjoy the holidays. Thank you all for being here. Yolanda is recommending that we, for those of you who want to become patient ambassadors for 2025, I definitely support you, and we'll see you guys all in 2026. Think about that. You can use your voice. You can be an advocate for others if that is your forte. And just imagine all the different ways that you can be helpful to other people. So each one can offer a source of inspiration to the other. If you're in dialysis, take a card to the person next to you at your next dialysis treatment. Or, whether it's something small, you pick up a little decoration thing, or something in your house that you no longer need anymore, you can pass it on to someone else. Just a little expression of kindness and gratitude. Just someone in the line at the grocery store. Have a happy holidays, enjoy the holidays, and the best to you. So just reach out and be grateful and pass that kindness on to someone else. Blessings for the end of 2025, and I hope to see you all again in 2026. Thank you so much. God bless.